Hey friends, welcome back to the USMLE Patterns channel. If you're new here, please subscribe for more clear, high-yield explanations. In our last video, we covered the journey of most oral drugs, ADME, absorption, distribution, metabolism, and excretion. If you haven't watched that yet, check it out first, because today's topic builds on that concept. Today, we're looking at a special group, highly lipophilic or fat-soluble drugs. These drugs follow a different path compared to most oral drugs. Let's dive in. When a patient takes a highly lipophilic drug orally, it travels through the mouth, esophagus, and stomach, and then reaches the small intestine. Here, absorption occurs mainly in the intestinal epithelial cells, called enterocytes. Unlike most oral drugs that enter the portal vein and go straight to the liver, these drugs take a different route. They are packaged into chylomicrons and enter the lymphatic system instead of the portal vein. From there, they move through the thoracic duct and finally reach systemic circulation. This means they bypass the liver initially, avoiding first-pass metabolism. Take a look at this image. On the left, you can see how absorbed lipophilic drugs travel through lymphatic vessels before entering systemic circulation. On the right, the close-up of the intestinal wall shows lacteals, the lymphatic capillaries inside villi, where chylomicrons carrying lipophilic drugs enter the lymphatic system. Once in systemic circulation, the drug distributes to target tissues for therapeutic effects, but it can also reach non-target tissues, causing side effects. Highly lipophilic drugs are not easily excreted in urine because they're poorly water-soluble, so the body metabolizes them in the liver, often through phase 2 conjugation, making them more polar. These metabolites are secreted into bile, which empties into the intestine. Here's the twist. Gut bacteria can break down these conjugates, regenerating the active drug. It's then reabsorbed into systemic circulation, a process called enterohepatic recycling, which prolongs the drug's half-life. Finally, excretion occurs mainly through the kidneys, urine, and liver, bile feces, with minor routes like sweat, saliva, breast milk, and lungs. Key takeaway. The unique feature of these drugs is their initial absorption into the lymphatic system, delaying first-pass metabolism and prolonging their action. Examples include fat-soluble vitamins, immunosuppressants like cyclosporine, and some antiretrovirals. If you have any tips or corrections, please share them in the comments. I really appreciate your input. And don't forget to subscribe for more clear, high-yield USMLE explanations. If you want